Welcome to Co-Pilot Podcasts. Your doctor's office is dying. Not metaphorically, literally going extinct. Today, we're diving into the healthcare revolution that's completely transforming how medical practices attract and keep patients. By the end of this episode, you'll understand why traditional medical marketing is dead and what's replacing it.
And it's not just marketing that's changing, it's the entire healthcare delivery model. We're seeing a fundamental shift in how patients interact with healthcare providers.
Let's start with something shocking. According to the search results, traditional medical practices are losing patients at an unprecedented rate to digital health platforms. Why is this happening?
Well, it's fascinating, actually. The data shows that patients, especially younger ones, are demanding what we call a hybrid model, combining digital convenience with personal care.
Wait, so it's not just about having a website anymore?
Oh, not even close. Having just a website today is like having just a phone number in the 1990s, necessary but nowhere near sufficient.
You know, this reminds me of something interesting. It's almost like what happened with dating apps, right? People were skeptical at first, but now it's just how relationships often start.
That's actually a brilliant analogy. Both healthcare and dating rely heavily on trust and first impressions. And just like dating apps, healthcare platforms need to create that initial connection while ensuring safety and privacy.
So what are the key elements that medical practices need to focus on?
According to the research, there are 5 critical components: digital presence, patient experience, technology integration, data security, and what we call omni-channel accessibility.
Omnichannel accessibility? That sounds complicated.
It's actually simpler than it sounds. It means patients can interact with their healthcare provider through whatever channel they prefer, be it WhatsApp, video calls, in-person visits, or home care.
But doesn't all this technology make healthcare feel less personal?
Here's where it gets counterintuitive. The data shows that more technology actually leads to more human connection, not less.
How is that possible?
Because when you automate the routine stuff, appointments, reminders, basic follow-ups, healthcare providers actually have more time for meaningful patient interactions.
That makes sense. But what about older patients? Surely they prefer traditional methods?
That's another misconception. The research shows that older patients, especially those with chronic conditions, are actually embracing digital health tools when properly introduced to them.
Really? That's surprising.
Yes, because for them, the benefit is huge. Imagine not having to drive to the doctor's office for every small follow-up or prescription renewal.
Let's talk about patient retention. What's working now?
The data shows 3 main factors: personalization, proactive communication, and what we call value-added services.
Can you break those down?
Sure. Personalization means using data to understand patient preferences and needs. Proactive communication involves reaching out before problems arise, and value-added services might include things like health education content or remote monitoring.
Speaking of data, isn't there a huge concern about privacy?
Absolutely. That's why compliance with LGPD, Brazil's data protection law, is non-negotiable. Every system needs end-to-end encryption and strict access controls.
You mentioned remote monitoring. What exactly is that?
It's using connected devices to track patient health metrics. Think smartwatches that monitor heart rate or blood pressure, sending data directly to healthcare providers.
That sounds expensive. Is it really worth the investment?
The ROI data is actually quite compelling. Practices that implement these systems see an average 40% increase in patient retention.
40%? That's significant.
And that's just the beginning. When you factor in reduced administrative costs and increased efficiency, the numbers get even better.
Let's talk about marketing. What's working now in terms of patient acquisition?
The most effective strategy right now is what we call educational content marketing, combined with strategic partnerships.
Can you give an example?
Sure. Instead of just advertising services, successful practices are creating valuable health content and partnering with local businesses, gyms, and community organizations.
But doesn't content marketing take a lot of time?
It does, but the research shows it's far more effective than traditional advertising. It builds trust and positions the practice as an authority.
You mentioned partnerships. How does that work?
Think of it as creating a health ecosystem. A practice might partner with local pharmacies, labs, and wellness centers to offer comprehensive care packages.
That's interesting. What about social media?
Social media is crucial, but it needs to be done right. The data shows that authentic, educational content performs better than promotional posts.
What kind of content works best?
Short-form video content explaining common health concerns, preventive care tips, and behind-the-scenes glimpses of the practice tend to perform best.
But isn't there a risk of appearing unprofessional?
Actually, the research shows that humanizing healthcare providers increases trust. People want to see the human side of medicine.
Let's talk about the future. Where is all this heading?
The trend is clearly moving toward what we call integrated care platforms, systems that combine in-person care, telemedicine, home visits, and digital monitoring.
Sounds complex to implement?
It can be, but there are now turnkey solutions available. The key is starting small and scaling gradually.
What about artificial intelligence? Is that playing a role?
Absolutely. AI is being used for everything from appointment scheduling to preliminary symptom assessment. But it's important to note that it's augmenting, not replacing human care.
That's reassuring. What about costs?
The initial investment can be significant, but the data shows that practices typically see positive ROI within 12-18 months.
That's faster than I expected.
Yes, because these systems not only attract new patients, but also significantly reduce operational costs.
What's the biggest mistake you see practices making?
Trying to do everything at once. The most successful implementations start with 1 or 2 key features and gradually expand.
That makes sense. What should they start with?
Based on the data, online appointment scheduling and a solid communication system should be the first priorities.
And what about patient feedback? How important is that?
Critical. The research shows that practices that regularly collect and act on patient feedback see 30% higher retention rates.
30% just from feedback?
Yes, because it helps identify problems early and makes patients feel heard and valued.
As we wrap up, what's your key message for healthcare providers?
The future of healthcare is hybrid, digital, and patient-centric. Practices that embrace this change will thrive. Those that don't risk becoming obsolete.
That's pretty stark.
It is, but it's also an incredible opportunity. We're seeing small practices compete effectively with large healthcare systems by leveraging these technologies.
Any final thoughts?
Yes, remember that all this technology has one purpose: to enhance, not replace, the human connection in healthcare.
Well, there you have it. The healthcare revolution isn't coming, it's already here. Thanks for joining us on Copilot Podcasts. Remember, your doctor's office isn't just